The story of Trinity Health began more than 170 years ago. With hope-filled vision, Catholic sisters arrived in America alongside the immigrants they served. They cared for wounded soldiers on battlefields and served in canal towns, logging camps, and mining communities across the country. They opened schools and orphanages, caring for the most vulnerable and underserved. This rich heritage of our founding congregations is at the heart of our core values: reverence, commitment to those who are poor, justice, stewardship, integrity. At Mercy Care, the compassion and reverence of health ministries founded by Sisters of Mercy inspire us to reimagine the future of healthcare.
The greatest thing about this job at Mercy Care is that the people who work here are so deeply rooted in a spirit of giving and a spirit of service. I wouldn't say with confidence we have inspired them any more than they have inspired us. Catherine McCauley lost her father when she was a very young girl in the early 1800s in Dublin. He was probably the person who had the greatest influence on her life. When she was probably in her 30s or 40s, she received an inheritance, and it was enough to construct a very, very large and attractive facility on a fashionable street in Dublin, which she did for the purpose of bringing in women and children who were either on the streets, or they were very, very poor, or they were being exploited in households as domestics, all types of things. But she saw this need, which was drastic. In 1831, she was urged by the church to establish a congregation because women had already started joining her. So they were doing things that looked like the church, looked like sisters. So she started the Sisters of Mercy, and she died 10 years after that. But the growth of the community was absolutely a phenomenon. And within a very short time, I mean, by 1843, it was in the United States. The sisters came from Savannah, and it was the whole state of Georgia was one diocese, and it was the Diocese of Savannah, and Bishop Gross was the bishop who asked them to come. So I can only imagine what it was like to travel what is now a 4-hour drive on good roads, but it must have been horrendous. Atlanta had a population that was a little under 40,000. It was becoming a metropolis. The story is, and people say it's fairly credible, that the 4 who came from Savannah had 50 cents. And they had to have had just an incredible faith because they started from nothing. They established themselves connected with the pastor at Immaculate Conception Church, which we still work with here in Atlanta. That's where our sisters first got their support. And then they were given philanthropic help, took over a little 2-story building, a house, and the Atlanta Constitution recognized their coming and said, we finally have a hospital under the Sisters of Mercy. The community very quickly got the name the Walking Nuns because they did not stay inside and the people came to them. They went outside to the homes of the poor, and that was their reason for going out. That became really, really meaning to us with Mercy Care, that going out to where the people are and finding them and bringing them in if they choose.
So it's a team effort. It's always a team effort with us. You know, I've been here about 13 years now, since '02, and you know, I love it. It's home for me. I wouldn't work nowhere else.
It's pretty intense sometimes, you know. You're approaching people. They don't know you. You don't know them. They don't know what to expect. You don't know what to expect. But it definitely is rewarding to see them wanting to receive services and then seeing the end result, you know, after they go through the whole process and they see you later and they're housed and they're receiving, you know, the necessary medications required. I think that whoever gets involved in this field, they should have an intent to want to help, no matter how it turns out. Just have the desire to want to help someone.
They are every bit as courageous and risk-taking and innovative as the sisters who were the walking nuns in Dublin. And when I think of the ones who are doing street medicine at night under the bridges, they certainly are doing work that is just as hard as the people who traveled across oceans to go out and care for people. It is a place where mission is not just what everybody gets, but what everybody comes to give as well. All religious communities took vows of poverty, chastity, and obedience. Catherine Macaulay added a vow, and it is a vow, the service of the poor, sick, and ignorant. So service is really the charism. Service to those who are most in need, service to the poor, whether they are plain poor or whether they're poor and can't get education, whether they're poor and can't get health care, or even if they're sick and not materially poor, but they experience a poverty of sorts. It's so intertwined, you can't have one without the other. But if I look at which one is the absolute foundation, I think it's that reverence or respect for the individual. Because I think everything else comes out of that. If we could each see the face of God in the person in front of us, if we do that, absolutely, we are going to be drawn to alleviate a person's pain. And we are also going to recognize, and I think this is so critical in our time, we're not giving somebody charity. This is their due. We have got to stop thinking, if we do, that somehow this is a gift we give. It is what is absolutely expected of us. It's what we can expect from one another as human persons.
Mercy Care and organizations like Mercy Care that are taking care of the most vulnerable populations, they got the idea of population health long before the rest of the healthcare industry got it. Because we're driven by looking at all the needs that the individuals who come to us for help. And so when you're looking at that comprehensive need base, you tend to start to put into place services and responses to those needs that are wraparound services. And then you're finding yourself taking care of the whole person. When you start adding things like case management and looking at housing issues and nutrition issues and adding behavioral health into your healthcare model and addressing things like transportation. I mean, we've been helping people get to medical appointments for a long time. So when you come to a clinic and you can get primary care, dental care, behavioral health services, vision, diagnostics, and that person is really got an individual who's centered around addressing all those needs, that's population health.
I think we've, shared so much of how the past and the present have meant in our own lives, and recognized that in all truth, we've been given a gift. It's a work of all who believe, who want to do good. And so my hope is that it will simply continue to be enriched by strong persons who have a kindred spirit, who want to go out walking among the people and really recognize as gift something to be passed along to future generations.
Wherever we work within the Trinity Health System, we are connected to the living legacy of our sisters. As faithful bearers of this rich heritage, we share the stories that bring us to a new place and inspire us to fulfill a new potential, to create a healthier future for the communities we are privileged to serve. The story of Trinity Health began more than 170 years ago. With hope-filled vision, Catholic sisters arrived in America alongside the immigrants they served. They cared for wounded soldiers on battlefields and served in canal towns, logging camps, and mining communities across the country. They opened schools and orphanages, caring for the most vulnerable and underserved. This rich heritage of our founding congregations is at the heart of our core values: reverence, commitment to those who are poor, justice, stewardship, integrity. Through their many healthcare ministries that are now part of Trinity Health, Sisters of the Holy Cross have served diverse communities with compassion and a commitment to justice, practicing population health before it had a name. Holy Cross Sisters continue to push at new frontiers. Their programs beyond the Trinity Health Network, like Holy Cross Ministries in Utah, show us the future of person-centered care.
As I look back on partnering with the Sisters of the Holy Cross, that partnership is what brought the Sisters of Mercy of Farmington and the Sisters of Holy Cross together to form Trinity Health System. The same type of partnership you see in the communities in which we serve, where we try to bring in other resources to work with us, whether it's a school system, whether it's a health department, whether it's a clinic, whether it's a business, knowing that working together we can provide enough access and resources to people who are marginalized and people who are poor and need our help. Father Moreau, our founder, sent 4 sisters to the United States, to Notre Dame, Indiana, in fact, to do ancillary services for the Holy Cross priest. It did not take long until the sisters decided that they wanted to do more and asked if they could start a school and began St. Mary's Academy, which is now St. Mary's College. The Sisters of the Holy Cross did not choose sides during the Civil War, and there were about 150 sisters here by that time. And 1/3 of those sisters decided that they would respond to the call to serve and to care for the soldiers, no matter if they were on the North or the South. The Sisters of the Holy Cross and other congregations decided that they would staff the Red Rover, which would go up and down the Mississippi and take in soldiers who needed care. It was really, I think, one of the first movements towards professional nursing. And it was a very, very dramatic response to those needs. A couple sisters came here, and I believe it was in the month of August. And they saw a need for education, and so they built a school and a hospital within 3 months. Mother Augusta started what I call the first HMO in the United States, where the miners and smelters could pay $1 a month for their family insurance. If something happened, they could be taken to the hospital and they wouldn't have any fees charged them. Now, those who did not join the HMO, of course, had to pay more when they were hospitalized. Sisters of the Holy Cross determined that the foundation that would be in Utah would be created based on needs in the community. So a community assessment was performed, and the assessment looked at the marginalized and what other services were needed. The assessment determined that we would serve mostly, I would say, Hispanics. Some people say, oh, are there Hispanics in Utah? Yes, there are over 400,000 Hispanics in Utah. We first began with what we call Promotora program.
Vamos a aplicar para Jesús, ¿no? Sí. Jesús, ¿cuándo nació Jesús?
A promotora is actually a bilingual, bicultural caseworker or outreach worker that we have stationed in low-income clinics or clinics that serve the community that is underinsured or uninsured. And a promotora basically is there to help the patients of the clinics navigate the different complex systems, the medical systems, the educational systems. And by sitting with them and maybe holding their hand through a process, we're able for them to see that they don't need to be afraid, that they're able to do this on their own. We're able to show them how to do this on their own so that they can actually become more independent and they can actually advocate for themselves in the future. The satisfaction that you get from knowing that you actually helped somebody and that person will be able to help themselves and others or their family, there really isn't enough money to cover that.
As we developed, we said we need to have some good education programs. So we started an after-school program and then realized by the time these children were in school in the after-school program, they were behind already. And so what could we do? So we decided at that point we wanted to start a school readiness program. So that was for 3 and 4-year-olds because we wanted them, when they went to kindergarten, to be starting at the same gate as their peers. It's very, very successful. The parents are involved in it. We do health, nutrition, we have yoga classes. We do all kinds of things to integrate them into the community.
I'm the parent educator here at School Readiness Program, and I help the parents with outreach. I drive the bus. I also help them with tuition and hear what they need to talk. They usually come to me and they probably come to talk about their kids, and they end up talking about their family and the issues that they have at home. And I usually refer them to whatever needs their help.
So the program grows, and then you say, okay, now these folks can get jobs, they can work here legally, they can go to school, they can get scholarships. It's a very organic approach to paying attention to what the needs are, listening to people, hearing what they need, and then responding to that, and it just grows. The charism of the Sisters of the Holy Cross is, I believe, like other religious congregations in that we respond to a need. We respond to the signs of the times. I think with Sisters of the Holy Cross, we try to be very warm about that, very hospitable. We also try to partner with others who can help join in with the mission and help to bring the mission about in people's lives. Trinity Health, I believe, is a leader in population health and people-centered care. And we have worked very hard in order to understand how we can best do that. This is a very significant and important change in healthcare where we're looking at, well, how do we keep people healthy? How do we keep them in the community to be productive citizens in that community? And when I say healthy, I mean in a very broad sense. How we help people to be educated, how we help people to communicate with each other, how we help people to strengthen their community. So it's a very broad-based focus, and we need to look at all the different parts of that community so we can get them together into acting, if I can say, in oneness, and building the community and building up the people in the community.
Wherever we work within the Trinity Health System, we are connected to the living legacy of our sisters. As faithful bearers of this rich heritage, we share the stories that bring us to a new place and inspire us to fulfill a new potential, to create a healthier future for the communities we are privileged to serve. The story of Trinity Health began more than 170 years ago. With hope-filled vision, Catholic sisters arrived in America alongside the immigrants they served. They cared for wounded soldiers on battlefields and served in canal towns, logging camps, and mining communities across the country. They opened schools and orphanages, caring for the most vulnerable and underserved. This rich heritage of our founding congregations is at the heart of our core values: reverence, commitment to those who are poor, justice, stewardship, integrity. At Mercy Medical Center, the foresight and good stewardship of health ministries founded by the Sisters of Providence, Holyoke, inspire us to reimagine the future of healthcare.
I was the president of Mercy Hospital for 16 years. I have a history with Mercy Hospital. I was born at the Mercy Hospital. I graduated from the Mercy Hospital School of Nursing, and after that I joined the Sisters of Providence. Then I had the privilege of being the president of Mercy Medical Center for 16 years. It was a great experience. I had opportunities that I never would dream of having. In 1873, sisters came down from Kingston to do some begging in the Holyoke area. Now, Holyoke at that time was the first planned city of the United States. It was built around 3 canals. The canal building was a hard job, people being injured, and as you know, workmen who worked that hard played hard. Father Harkins, who was the local priest, was very enterprising. He said, "I will allow you to beg in my area if you'll go back and ask your superiors to send me some sisters. I'm desperate. We have people here with great needs and nobody's responding to those needs." So they were allowed to beg. They brought back money and they sent 6 sisters to Holyoke, Massachusetts. Now they actually lived across the river in South Hadley, and every day they rowed across the river to do their ministry. They were here 3 days and they had their first orphan. Mother Mary of Providence was among the first sisters who came to Holyoke. She had a vision. She was just so dynamic. She responded to the needs in ways that people couldn't conceive. The sisters were doing health care, but it was really in their homes. And she saw the need of bringing all that together and creating a hospital. So the Providence Hospital was built, and that was the first hospital in Holyoke. But it was not just hospital patients. We had orphans there. We had elderly women who had no one to care for them, who were dying. They were there, and we had patients. Mother Mary of Providence, said so many things, and we cherish so many of her words, but there's one quote that really stands out and really motivates me. "Never rest on what has been accomplished, but always press forward to what yet needs to be done." And to me, that's a motivating force in my life. It's part of my very being. It's what makes me tick. It's really, in my mind, it's just so important and something to live by, something to energize me. I'm very proud of Trinity Health and across our system in terms of how much we do for community benefit. But we have to be good stewards. We have to make sure that we're in programs that provide income. We have to find ways of making ends meet, and we have to be cautious about what we do and how we do it. Stewardship is very even-keyed. It's not all about making money. Stewardship is taking what you have, using it appropriately, make sure you have enough to go around. And to me, that's stewardship. Within our health system, it's a virtue, it's a value, it's something that we respect and honor. I used to say to people when I was the CEO at Mercy, you're far more important for who you are than what you do. I can't do your job, you can't do my job, but it's who you are that really matters. There's a spirit. When you walk into one of our facilities, you find a spirit that they're a welcoming spirit and willing to help kind of spirit. For me, walking to a place and finding that feeling of welcomeness, if somebody wants to work in that environment, they're going to be happy in Trinity Health.
I'm a medical oncologist, and I've been practicing in the Springfield area for over 20 years. And myself and half a dozen medical oncologists who were in private practice decided we'd be better serving the community, working better together. And it gave us an opportunity to get involved in an exciting project at Mercy and developing a cancer center here.
So we plan it and we re-verify on the machine before treatment.
But this is very high definition.
This is a high definition.
Yeah.
In the early 70s, there were 3 million cancer survivors in America. Now the number is 14 million, and it's going to go to 20 million over the course of the next half dozen or so years. Right now, we're a little disjointed. We have 8 oncologists spread over a pretty substantial space with 2 different infusion rooms, 2 groups of nurses, and 2 different spaces. This will put us all under one roof.
So it's not about building a building, which is a necessity. But for me, the exciting thing is we're building this new opportunity. Again, reaching out, starting something new, making something happen.
We'll have a pharmacist right there. It's going to be easier access for patients. It's going to be easier access for physicians, and the nurses are going to be totally in one space. It's going to be a big difference.
And right now, we're just at the beginning. If you had a piece of paper and you put a pin through it, that's where we are in terms of using new modalities of treating cancer.
I think that our invitation is to be part of that and to make sure that we're bringing that to this community. Maybe not to cure cancer, but help people to live with their cancer, help them to have good quality of life with their cancer. And I think that's the tomorrow of where we're going.
The charism of the Sisters of Providence is really to respond to those in need. We follow the rule of St. Vincent de Paul, who told his sisters that their cloister was the streets of Paris, to get out, be among the people, do the work that needs to be done. For me, that's fine, but mine is a providential charism folded into St. Vincent de Paul. And you only understand providence in the rearview mirror. After you reflect at the end of a period, you look back and you see where God has worked, where God has given you the opportunities, where there's been no reason why you should be in a certain place at a certain time, but lo and behold, you were. The sisters in the beginning were doing everything. They were the workers in the hospital. And then along came the student nurses. So it was the sisters and student nurses. And then we brought in more professionals. So the sisters had a great role, but we're diminishing in number and we're getting smaller and getting older like myself. I'm not going to be around that much longer. And so I'm really confident that our role right now is to inspire people and have them catch the spirit. So going forward, when there aren't sisters, and the question used to be, what do the sisters want us to do? And then now there are fewer sisters, what do you think the sisters would like us to do? Now people have got the spirit, and it's what should we do? And I think for me, that's the thing that gives me hope in the future, and knowing full well that the sisters aren't going to be here, and people coming behind us, I hope they'll continue to carry that spirit. I know they will. I really, in my heart, know they will.
Wherever we work within the Trinity Health System, we are connected to the living legacy of our sisters. As faithful bearers of this rich heritage, we share the stories that bring us to a new place and inspire us to fulfill a new potential, to create a healthier future for the communities we are privileged to serve.